With cases of the coronavirus already above 13,700 in Cameroon and over 11 million globally, and already above 320 deaths reported in Cameroon, with 524,000 globally, there are even more fears as to the safety of children in the northwest and southwest regions of Cameroon, especially as they are back in school to prepare for their exams. With schools lacking sufficient benches to accommodate children, as in this scenario, there is a genuine need for fear. Lukmef International Cameroon, in partnership with Street Child, a UK-based organization born of Tom Dannard's experience in Sierra Leone in 2008, are partnering to build the capacities of local organizations and some teachers on effective monitoring and reinforcement of COVID-19 preventive measures.
Cameroon, just like other countries in the world, is currently battling with the COVID-19 pandemic, which is a global issue. At the moment, we have our schools going on with those in examination classes. So we believe that this particular training was very key for us to bring together teachers who are working with the students who are already in schools to ensure that they have adequate information on COVID-19 prevention, control, treatment, and how they can manage coronavirus in their schools. So that is why we decided to organize this training so that we can help to build on the knowledge of these teachers so that they can be able to understand facts as opposed to myths and misconceptions. And when they go back to their school, they can be able to share with their students and peers these facts as opposed to the myths that are already in a lot of our schools and communities. This particular activity targeting teachers, we have done this training in the Northwest region and we have also done it in the Southwest region. So the training actually targets teachers from 30 highly populated schools in the Northwest region and in the Southwest region. So far we have had a total of 60 teachers trained, and these teachers come from different areas in Mezam division, from Bamenda 1, 2, and 3, most especially.
Lukmef and Street Child have so far had training sessions with organizations working with persons with special needs on mainstreaming persons with special needs in their COVID-19 response strategy, with teachers and heads of some schools in the northwest and southwest regions of Cameroon on effective monitoring and reinforcement of COVID-19 preventive measures in schools, and with some local civil society organizations on effective COVID-19 response mechanisms within their organizations. Together, participants brainstormed on various ways of ensuring effective prevention.
We ensure that people regularly wash their hands before and after going out. There is a compulsory use of face masks. Visitors also wash their hands on entering into the school campus. What we will really need, the priority needs, we don't have a thermal flash for measuring the temperature, and also we lack the basic drugs to administer to people in case they are ill, like paracetamol.
Participants also share their lessons learned from this series of trainings.
I've learned so much about how the COVID-19 is spread and how it can be managed, how it can be prevented from this workshop. I want to thank the organizers of this workshop, and I say, as I'm leaving from this workshop, my schools, I will equally organize a workshop like this to enlighten them more on how they can effectively prevent this pandemic.
This training has actually been enriching because as an organization we have learned a lot. This organization, that's Down Syndrome Association Cameroon, has learned a lot in terms of mitigating the effects of the COVID-19 on persons with disabilities, thus reducing the chances of persons with disabilities getting in contact with COVID-19. So I think that it is going to go a long way to reduce the amount of persons with disabilities who are infected of the virus, and also to serve as an eye-opener to many other organizations to be able to implement their activities, including persons with disabilities, just like Lukmef have done.
Personally, I've been trying to sensitize lots of people, but I witnessed lots of denial on the ground. But a lot of the resistance is also coming as a result of strategy in which people are using to sensitize the public, especially schools. But today I've acquired a lot of skills and knowledge on how to effectively handle those challenges. National Volunteers Forum is definitely going to do a lot as a result of the knowledge and the skills acquired from here, because we have to cascade it down the lane by first and foremost developing what we learned here about standard procedures. Some of these things, resistance on respecting those measures is partly caused by lack of laid down procedures in organizations.
As concerns the workshop had really been awesome. It has opened up my brain. It has shown me some possibilities, shown me a lot about the disease on its own, how the disease spreads and every other thing. And most importantly, it has shown me how I can include schools. As we all know, schools are reopening in Cameroon now, especially the examination classes and the universities. So it has helped me how I can, improve my reach out in schools. It has also helped me such that I should be able to include disabled people.
Things that people have put in their minds about coronavirus, many of them were destroyed here. For instance, when many people out there are talking of gargling with salt and hot water, we learn here that it is not the best. Eating or chewing garlic all the time, that is a measure to fight against coronavirus. We notice that those are just rumors and myths that people place in their minds.
This workshop actually, I would say, is a blessing, because I had little or no idea on how to go about the preventive measures with regards to the students. One of the things I learned was the mere fact that I didn't really know that handicapped students had some certain measures or ways to attend to them.
So today we invited 15 participants from 15 organizations to come for this training. It's a project we are implementing with Street Child, and we deem it necessary to train 15 organizations on COVID-19 case definition, how to do with suspected cases, how to protect staff from infection, and how to develop the standard operating procedures that support COVID-19 activities. So essentially, the training was really a success. It was really good, and it's really necessary because humanitarian workers are at risk of contracting the disease, and they are also at risk of sharing the disease to the areas of where they are intervening.
They are prepared to pass on the knowledge as they retire to their respective posts of duty.